Okay, thanks everyone for joining us for our member showcase presentation. This is the part of the programme where we highlight some of the great work happening within the sector. And today's showcase, as you see on the screen, features South London Maudsley NHS Foundation Trust. We'll hear from the Trust how they responded to increasing concerns over staff wellbeing during the pandemic. I'm sure an issue which many of you have faced. We will get an opportunity to view a short animated video followed by a presentation by Dr. Mary Docherty, a consultant liaison psychiatrist and interim joint deputy medical director for quality and patient safety. She'll be joined by Dr. Martin Parsons, a senior clinical psychologist at the Trust. There'll be a short Q&A after the presentation.
Start of the pandemic, South London and Maudsley and King's College Hospital NHS Foundation Trusts wanted to respond to increasing concerns about the psychosocial health and well-being of staff, but there was limited guidance on how to best support them. To overcome this gap, they partnered, designed and implemented an evidence-informed response to support over 14,000 staff working in King's College Hospital under extreme conditions. The Trust delivered a tiered model that used 6 core interventions to increase knowledge in self-care and stress management. These included wellbeing hubs with areas for food, rest, information and peer support, embedded mental health and organisational development experts in wards, teams and the hubs, a team-based support service to help teams process events and embed wellbeing into day-to-day processes. The strategy was successful in its scale, reach, sustainability and impact on staff wellbeing, which positively impacts on patient experience. Following a staff survey, 70% of respondents said it helped them to cope with work. Data collected suggested value was created through impact on culture, morale, and likely preventing absenteeism among staff.
Good afternoon. So thank you, Kerr, and to NHS providers for inviting you to tell you about our team's work. So I'm Mary Docherty, a psychiatrist, and this is Martin, a consultant psychologist. So over the next 10 minutes, we're going to tell you about our programme, what we all did, what it's achieved, and hopefully what we learned along the way. We also hope during our Q&A to think with you a little bit about implementation lessons and how as an NHS we can preserve and use the learning from the last year to change how we look after our workforce. Next slide, please. So you've heard a little bit about our programme in the animation. Oh, sorry, next slide, please. Thank you. You've heard a little about our programme in the animation, but I wanted to start with a little bit of context. So our hospital was among the very first in the UK to be hit by the COVID-19 outbreak. There was no roadmap, national offer, nor existing infrastructure in our organisation to respond. But within 4 weeks of first hearing concerns from staff, we built a workforce of over 80 people, conducted a comprehensive evidence review, designed and implemented a whole organisation tiered and targeted staff support programme, providing accessible and holistic range of supports for staff. But at the heart of our design, however, was a strategy, and this was to offer containment and to future-proof our workforce by skilling up staff to look after themselves and each other, but also to change processes and structures that would protect wellbeing and influence culture well after the pandemic. Now, we used a range of tools to do this, including training, coaching, reflective practice, and nudge techniques, all designed to help weave wellbeing into the fabric of their day-to-day work and departments. Next slide, please. So we embedded an evaluation programme in delivery. We used action learning, activity trackers, and qualitative data to ensure that staff accessing the programme were at its centre, involved, directing its evolution. And at the programme's core was a principle that we wanted to get alongside and do things with, not to, our workforce. Next slide, please. So reflecting overall on what made the programme so impactful, I'd say collaboration was our secret sauce. For example, we partnered with academic colleagues. We set up a local research programme to monitor staff wellbeing over time. This is now the largest longitudinal study on staff health and wellbeing in the UK, NHS Check. We also drew really heavily on the incredible assets in our local community, be that multidisciplinary expertise, programme management skills, but also support of local businesses and our volunteers. We established a unique listening function to ensure that frontline experience was heard and directly responded to by command and control operations. That was the first 4 weeks. Now, this listening function was the first step in what has progressed and matured over the year to be a significant piece of organisational redesign. As well as establishing a permanent wellbeing service for King's staff, continuing the programme's core elements, we ensured that wellbeing is front and centre of what we do at King's, both as an ethos and operational policy woven through procedures, processes, and communication. In retrospect, our ambition was quite outrageous. It wasn't just to support our workforce through a pandemic, it was to build sustainable change through skills, roles, structure, and culture, and to develop an empowered, compassionate, and resilient organisation able to deliver on both of its tasks, to care for its people and its patients. Next slide, please. So the key aspects of our work that we think added real value were firstly, the combined use of evidence, strategy, and innovation to create immediate and long-term impact and ensure continuous learning. Secondly, a principle of humility that underpinned each aspect of what we did. We knew that no one is an expert here, and we powered our approach through true multidisciplinary collaboration and partnerships with our people, our local system, and our community. And finally, our commitment to sustainability and ensuring this wasn't a pop-up morale-boosting initiative, but something that would last and deliver clear outcomes and value. And it's these outcomes that Martin is going to walk you through now.
Thank you very much, Mary. If we can go to the next slide, please. So, as you can imagine, it was challenging to try to embed evaluation in a program that was built so quickly, but we felt it was critical. So we evaluated impact through multiple different approaches using surveys, interviews, and a whole organisation insights project that engaged staff across all grades and disciplines, including those shielding. Next slide, please. Our data has shown that our reach was enormous. We included the voices of over 2,500 staff in the programme, reached over 180 wards and teams, conducted over 800 reflective groups, and helped to signpost over 4,000 staff to other supports. Next slide, please. We set up 4 main wellbeing hubs and 7 local wellbeing spaces for staff. Distribution of food and other resources was comprehensive. For example, the team delivered over 2,600 wellness boxes in the last month and a half alone. We have also helped enrol over 2,500 staff in research and achieved 540k in new investment for wellbeing related jobs at King's. Next slide, please. In terms of value, a first wave service evaluation told us that 70% of staff felt that the programme helped them to cope in work. 60% felt more positive towards the organisation, and 55% said that the support that they received helped them to actually stay in work. Next slide, please. Themes from the qualitative data with over... Next slide, please. Thank you. Themes from the qualitative data with over 1,200 staff responding showed improvements in morale, cohesion, and connectedness, engagement, improved problem solving, mental health literacy, confidence and self-management and supporting colleagues. But the consistent standout observation from all staff feedback we have had, and perhaps what we are most proud of, has been the impact on culture. Things have changed in King's, and that cultural shift will be the key in sustaining work and movement in the longer term. We're now going to hear from one of our colleagues, Sam, on what we did and how things have changed.
Hi, I'm Sam Thenabadu. I'm an emergency medicine consultant at the Princess Royal and lead on wellbeing. This has been one of the most challenging 12 months for all of us on the front line, both personally and professionally. So we're hugely grateful for the support offered to us by the King's Wellbeing Service. We've been lucky to have a huge range of support, including resources and materials that have helped us on a day-to-day basis, including specific advice and materials around psychological safety when starting shifts, about how to lead our safety huddles, and strategies to offload when finishing. We've had incredible reflective space sessions which have been led by trust psychologists and allowed us to take stock of where we are and how to move forward. I think there's often a cynicism around wellbeing, that it can become a tick box exercise, but what I think we've seen is a real culture change and the trust determined to set this as a priority going forward.
So in our last few minutes, we wanted to share where we are now and what we have learned since those first 4 weeks. Our ambition was to reach the whole workforce and embed new skills, processes, pathways, roles, and structures. Perhaps the biggest active ingredient in making this work was partnership. Staff wellbeing belongs to no single department, and we created a collaborative that involves psychology, psychiatry, organisational development, HR, equality, diversity and inclusion, chaplaincy, and our King's volunteers. It's still growing and coalescing now as we speak. We found that a tiered and targeted model of interventions was effective in meeting the wide range of needs and preferences of our diverse workforce. Having executive buy-in was also essential. We wanted to shine a spotlight through the whole organisation, board to floor and back again, and impact the core structures and processes that determine the how things are done around here. Involving key execs and directors to get plans heard by those in charge gave the movement and the authority and status it needed to drive our strategy and unite the different departments involved. Our King's Boardroom has remained the wellbeing hub used by thousands of staff every week. New hubs, purpose-built versions, are being renovated. Our governance now includes a weekly board report on the wellbeing of staff. A new health and wellbeing team has been appointed. A team of staff to run the hubs is in post, and a new psychology team is being recruited. Wellbeing has moved to the heart of the organisation and is growing there. Every ward and directorate is now engaged in our programme and has received training and support to implement and embed tailored wellbeing approaches within their departments. We also have a team of trained wellbeing partners and are growing a cadre of embedded departmental wellbeing champions. This was very much a homegrown initiative built on relationships, passion, and determination to do better. Partnering this authenticity with the authority and containment provided by the team's professional backgrounds ensured the programme was safe and governed. I'm now going to hand you back to Mary.
Thank you, Martin. So just to summarise, if we could move to the next slide, the key elements of this work above and beyond the interventions used, so that it was evidence strategic and innovative. We blended research evidence with systemic thinking and quality improvement methodology. We knew no one as an expert here, and its impact was entirely due to multidisciplinary collaboration, and it was sustainable. We shifted the dial by harnessing the key strengths of our staff and by building structures and culture where they could be nurtured. Now, I just wanted to share that there's a motto in King's. We say that we do things the King's way. It describes the pluckiness, the spirit of our people to get through and pull it off no matter what is thrown at you. King's has had a very challenging number of years, and we entered into this pandemic in a precarious position. But we've shown what happens when people get together and do something wildly ambitious for no other reason than they care about our NHS and the future of those people that power it. Those 4 a.m. starts to distribute food, create beautiful rooms, write training packages, research grants, operational policies, and above all, the utter privilege of being partner and facilitator to so many heartbreaking conversations, helping staff process the horror of what they were going through so they could go back to work. Hard work, dedication, and care, no matter what is thrown at you. That is the King's way, and what at core this initiative has been all about. Thank you for listening.
Thank you, Mary, and thank you, Martin. Really inspiring stuff, really quite exciting. While colleagues are thinking about their questions, could I just ask you, what was the biggest surprise coming out of this for you? I mean, you mentioned, I think, the culture at one point, the culture change as being a big issue, but is that the biggest surprising benefit that came out of it, or was there something else?
I'll start, Martin, then maybe you add. For me, it was the absolute desire and really very quick buy-in from the whole of the workforce as to how important this was. We thought we'd have to do a lot more on the hearts and minds on, well-being isn't just something sort of fluffy, this is absolutely critical to you and your professional development as a healthcare professional. So I think that to me was the big surprise, the sort of the appetite and also the absolute appreciation by staff that something like this was able to happen. Martin, I don't know what your views are.
Yeah, there was lots of things that came out of this that were surprising. I think one of the biggest things was actually kind of how much we didn't know. I think we didn't really have a very good grasp of, how things were in King's in terms of the impact on staff of working here. And really, COVID has kind of created a platform to permit conversations around that. So I think that that's been, I suppose, surprising, but maybe shouldn't be that surprising at the same time.
There's a question about longevity now that we're returning to some new normal. Is this really going to drive forward and be sustainable? Do you feel confident that the change has been made? This was an inflection point, and you're going to be able to do this in the future in a different way?
I think so. I would say, like, on the whole, yes, we have managed to kind of make some aspects of this sustainable. What we did during wave 1 of COVID, I don't think was ever going to be sustainable. It was a huge effort that involved something like around 70 staff members contributing their time to try to support the hospital, and we were never going to get through a business case to recruit that many people into a staff wellbeing team. We do now have a permanent psychology team that is being appointed. We have a new health and wellbeing team that has been appointed and is kind of, in their 3rd week of being in post now, and sort of getting to grips with things. And we have permanent wellbeing hubs that are being created. The ones that we have up at the moment are still sort of in their temporary locations, but there are new ones that are being renovated at the moment. So it's definitely here on the map to stay, and I think it will continue to grow and evolve as the next kind of few years unfold.
I think the other bit for me was sustainability, and I think this is one bit of the programme that we actually did I think we did well. We were very strategic in who we were targeting to get involved in this from the outset. So when we describe a programme that's tiered and targeted, it was targeted towards individuals, teams and leaders. So what we did over those really resource-intensive early months was specifically working with kind of the key people in the organisation that influenced how others were. So, for example, running weekly reflective practice groups with our ward matrons and our ward managers, and also various other leaders. And I think what we've got that is so different now from a year ago is we have this sort of cadre of leadership of people that genuinely influence how others do things in the organisation, that are fully bought in, that are skilled up, that feel authorised to talk about wellbeing and are knowledgeable about it. So I think that's kind of the intangible asset that we've also built, that, when things start to forge ahead and, we've got really difficult years ahead of us, we've got that infrastructure and that sort of, that wide range of people that I think will continue to beat the drum alongside the changes in the structures, the processes, and even just the staff roles that we've put in place. But great question.
Really, it's really exciting, this whole thing. I've got a very specific question from someone. How have you been able to implement rest facilities and encourage napping for staff? If so, how has it been received?
I think that's a really good question. So actually, I was having that very conversation with staff in A&E recently, that sort of very tentatively talking about the idea of trying to get sleep pods. These kind of, it's the opposite of sensory stimulation. It shuts you off from everything and enables you to kind of have a completely disconnected environment to sleep in. I think that's still kind of an idea that's up in the air at the moment and nothing concrete. But it's such an important aspect to well-being, having somewhere where you can go and be able to kind of shut your eyes, particularly if you're, working on night shifts and your internal clock is out of sync. That's so incredibly valuable, but also a very difficult one, I think. Very tricky as to kind of what's appropriate and what's not. And I think we'd almost need some new policy around that to try to implement it. Mary, I don't know if you had any thoughts on that.
No, I think it's a brilliant question. I don't think we've fully solved it. I think it's something that really needs thought about. Something that will really stay with me during I think it was probably first wave, was a picture of someone we put comfortable chairs into the hubs where you could actually have a little snooze if you wanted. And one of the demonstrations that actually this stuff was working was because we had someone able to just have a little bit of shut-eye there. But I think this is a great question. I think it'd be really interesting across trusts. How are we tackling this? How do we move from it? No, you cannot sleep at work. So how do we make sure that you have rest that enables you to do your job? So I think great.
No, those are great cultural things, isn't it? Just a final question, I think. Obviously, on this conference, we're talking inevitably the opportunities and challenges of moving from organisational focus to system focus is coming through. And I just wondered, how are you working in South East London to take this learning, which is really considerable, as you've explained, into the ICS, if you like, into the wider system?
Yeah, I mean, the simple answer is I was very involved in the development of this work alongside 80 other incredible people, but I sit on the ICS Health and Wellbeing Committee. One of the key things that we're doing, particularly with the NHS Check data, is that there's a number of trusts across the country that are involved in NHS Check, but particularly our local acute trusts, we're going to have really good data on how our staff doing. Is the original panic that everyone's going to be completely broken by this? Is that going to, pan out over coming months? We've also had some ability to experiment with the CCG. So a lot of the resources that we developed for acute trust setting, our CCG colleagues were able to tailor them to what's going to work in a primary care setting. If I'm going to be honest, where I think the biggest gap is, what are we doing to support our social care workforce, and what are we doing to support outside of the hospital staff? I think that's where there's a big gap. But I think the headline is that we have the right people in the room, and we've got the curiosity and interest to say, would this work? Would this not work? What do we test? And have an evidence-based approach underpin it. So we're not just doing things blindly and saying, oh, here's a solution, let's do it. We're using the same sort of principles that we embedded this program with, which was every day, and then at certain points every week, we would check ourselves and go, is this working? Is this what staff actually want? So I think that was where we had this really big gap. What do staff want? What do they need? What do we think they want? And what did we give them? There's potential gaps every step of the way. So I hope at our ICS level, that's something that that principle of humility is really informing how we develop our strategy alongside the people plan work.
Thank you, Mary. Really comprehensive answer. Thank you. Thank you both as well. That's been a fantastic session, a really great start to our showcase sessions. And I think colleagues have enjoyed it. We could probably talk quite a lot longer with the questions we've got, but we've got to go on to the next session at 12:30. So thank you, and more power to your elbows going forward. Thank you again to Mary and Martin. Bye.
Thank you for having us.
Thank you.